Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
The Centers for Disease Control and Prevention is battling one of the worst Ebola outbreaks on record, calling on its workforce to help contain its spread overseas. But the CDC is dealing with last year's staffing cuts and still lacks permanent leadership in many of its roles. Further, internal surveys show employees responding to the outbreak are also dealing with low morale. Federal News Network's Jory Heckman is joining me with more details. Jory, thanks for being here.
Hey, Terry. Great to be here.
First of all, tell us what CDC is really doing in response to the Ebola outbreak.
CDC across its nearly 24 centers, they are doing a full court press to address Ebola. This is, of course, happening overseas, largely in the Democratic Republic of Congo as well as Uganda. But this is an overseas effort, and they're trying to keep it that way. They're trying to keep the spread of Ebola from coming overseas to the United States. And so this response is looking both domestically and internationally. The CDC has employees set up at airports across the country trying to screen passengers, ensure that this isn't something that is an issue. And overseas, it is working with the ministries of health of other countries to contain the outbreak and make sure there's an on-the-ground response.
Do you have a sense of how many employees are actually engaged in the Ebola response?
What I had heard from at least one of the centers here that's primarily in charge of this, the National Center for Emerging and Zoonotic Infectious Diseases, doesn't exactly roll off the tongue here, but they are one of the centers primarily involved in response. What I had heard from, based on an internal recording that I received a couple of weeks ago, they had somewhere in the neighborhood of 200 employees actively involved in that response, and they're calling on more employees to raise their hands, to volunteer, to do more of the airport screening.
Working on Ebola has got to be a little nerve-wracking, very much a life or death scenario. How is that fitting in with all of the changes that happened at CDC over the last 12 to 18 months?
Well, CDC, much like the broader Department of Health and Human Services, has gone through major staffing cuts. What we saw with HHS more broadly is that they saw about 20,000 employees leave last year. That was a combination of layoffs and voluntary separation incentives. What we've seen at the CDC is that they've seen more than a quarter of their staff leave since the end of fiscal 2024, roughly aligns with what we've seen happen under the Trump administration so far. And so what we've seen, based on what I've seen from CDC staff and internal polling that employees have shared with me, job security and fear of additional layoffs were top concerns for this survey that they shared with me, which showed that about half of the NCEZID staff either rated morale as low or very low, and only 4% of staff said that morale was very high.
So when you're asking a reduced workforce to volunteer for potentially deadly duty, that seems like a real challenge for their leadership.
Yeah, this is a huge stepping up of the work that they're being asked to do. And you're seeing fewer employees on the job to do that work. And, there's also been some other drivers of low morale at CDC. They've been the agency amongst many other agencies that have been really restrictive for telework as a reasonable accommodation. That's been one thing. And something else we recently discussed, Terry, is that the CDC's annual performance bonus evaluations have been going on. And what we had learned is that CDC was going to rein in some of its bonuses for its top performers. They were originally slated to get a 4% bonus if they were getting fives, top scores on their performance evaluations. What we had learned is that they were then on track to get something close to half of that original amount. So certainly not going to help morale in that regard either.
Jory, you're describing a really tough work environment, and it seems like it's complicated by missing a lot of permanent leadership at CDC. How is that playing out?
Well, just to take a look at things here, there is no permanent CDC director. The permanent NIH director, Dr. Jay Bhattacharya, is working double duty here. He is the acting CDC director, but not even the CDC acting director. He has exceeded that formal designation under the Federal Vacancies Reform Act. He is now kind of the interim leader of CDC, but it's that legalese of performing the duties of is kind of his formal title at CDC. But there's also no permanent director of the Food and Drug Administration. There's no permanent Surgeon General. And what we've learned is that over 80% of CDC center directors are being led by acting officials. That's raised some concerns with some former CDC officials saying that this is not the kind of scenario you want when CDC is being asked to do more and step up.
Jory, Ebola is certainly the big headline, but CDC is dealing with all kinds of other outbreaks. We have domestic measles outbreaks. We have hantavirus that was in the headlines just a few weeks ago. How are they trying to respond more systematically to these various challenges?
Well, on the same call, I did hear from the people who are leading the hantavirus response, and they actually said, job well done. We've done a pretty good job of containing this, and that by and large, the mission is going well in that regard. And so that was one example of CDC internally saying, job well done. The staff is stepping up to address hantavirus, but there's other things going on as well. Of course, CDC is working with the Agriculture Department for the return of screwworms in this country, and that's a big concern for cattle and livestock more broadly. So that's yet another big project that CDC is being asked to do, in addition to everything that you just described.
Do they have any hiring plans to try to rebuild the workforce?
They do, although it's very interesting to see how that's played out. HHS Secretary Robert F. Kennedy Jr. has told lawmakers that HHS is broadly going on a pretty significant hiring surge, that they have the authority to hire about 12,000 employees across HHS. This would actually bring the HHS workforce to higher levels than it saw before the Trump administration. But for CDC, they've been given the authority to hire somewhere in the neighborhood of 900 positions. What I've heard from many CDC employees, and I've spoken to quite a number of them, they say that that's not really translating to hires on the ground, that they are just not seeing that hiring materialize just yet, and they have yet to get the official go-ahead from HHS to carry out those hires.
So we've got low staff, low morale, really challenging world environment that these folks are having to respond to. What's your sense of what's next?
Well, I think one thing to keep an eye on is if and when CDC gets the approval to do this hiring, if it makes hundreds of hires as it's allowed to do on paper, and what that hiring looks like, and whether it gives relief to these employees who do feel that they've been stretched thin. This has been an agency that is being asked to do more with less, and we're seeing some of the strain here.
That's Federal News Network's Jory Heckman. Jory, thanks for keeping us up to date.
Thanks, Terry.
You can find his story at federalnewsnetwork.com.